To build a fairer response to addiction, we need to understand both the science and the story that got us here. A century ago, addiction was often mislabeled as a personality problem. Prohibition didn't end alcohol use, it pushed it underground and fueled harms. As mass media expanded, sensational narratives shaped public opinion in ways that still echo today. In 1971, national policy reframed substance use as a crime, and in the 1980s, crack cocaine sentencing laws punished crack far more harshly than powder cocaine. The impact landed hardest in low-income urban neighborhoods and communities of color, prioritizing incarceration over care and leaving a legacy of mistrust, fragmented services, and treatment deserts. The science tells a different, clearer story. Addiction is a chronic, relapsing condition driven by changes in brain circuits involved in reward, stress, and impulse control. That is why just stop isn't effective advice. It ignores what the condition actually is. Substance use disorder, or SUD, is diagnosed by patterns of harm across 4 domains: impaired control, physical dependence, social problems, and risky use. The more criteria a person meets, the more severe the disorder. At the severe end, SUD overlaps with what we call addiction. Tolerance and withdrawal are part of this picture. Tolerance can be innate or acquired. It doesn't always progress evenly. Withdrawal often shows up in 2 waves: an initial, more physical phase, followed by a longer stretch of cognitive and emotional symptoms. Naming these processes accurately helps us respond with steadiness and respect. Risk and protection are about context. Early exposure and high availability raise the odds of initiation. Routes that produce faster effects can accelerate reinforcement of substance use. Co-occurring mental health conditions and genetic or epigenetic factors shape vulnerability. Family supervision, peer refusal skills, and early aggression matter too. None of these guarantee addiction, they simply mark where prevention, support, and relationships can do the most good. In other words, build protective environments, not just programs. Places where people have reasons to stay connected, safe, and hopeful. Now, the equity lens. Structural factors determine who gets a fair shot at help. Many rural and low-income urban communities lack accessible services or have long waits. Insurance can require multiple approvals, adding delays and detours. In clinical settings, stigma erodes trust and short-circuits the relationship, making people less likely to return. Poverty increases exposure while reducing options, especially in communities where services were historically underfunded. Criminalization still falls unevenly. Rural-urban gaps persist, and women often face gendered stigma related to parenting and child welfare involvement. When you see these patterns, you're seeing systems, not isolated choices. How should future health leaders think about solutions? Recovery-oriented. Plan for a long arc with stability, setbacks, and progress. Person-centered and trauma-informed. Safety, dignity, and choice are not extras, they're essentials. Low barrier. Simplify steps from first contact to follow-up. Make it easier to say yes to care. Language matters. Use person first, not stigmatizing words. Person with a substance use disorder, not addict. Community and lived experience. Partner with peers and local organizations that know the terrain. Data-guided and local. Pull campus or county data, identify who's most effective, map what exists versus what's missing, and focus attention where it'll matter most. This is the education pillar in action. Understanding the condition, the context, and the systems, then using that knowledge to build environments where recovery is possible and dignity is the norm. When we move from blame to evidence, from punishment to problem solving, and from isolation to connection, we create a response worthy of the people we serve. At Voices of Equity, we are committed to raising awareness, sparking conversations, and driving action around health equity. Whether you're a student eager to learn, a professional looking to contribute, or someone who wants to support equitable change, there's a role for you in this journey. So what can you do today? Start by visiting our website, thevoicesof.org. Explore inspiring stories, access valuable resources, and discover opportunities to get involved. Your voice matters. Join the movement and make it heard.